Hello, my dear ones. So I've been meaning to do this, like, get ready with me. I have a towel on, okay? Just so you're not worried. I just have this, like, lower than, I don't know. I've never tried this before. See, I have a towel on. I just took a shower. And I have been thinking, like, maybe other people would like to know, like, what I do as a trans non-binary Afab person, because I'm curious about other people. So first thing that I'm, like, super nervous about is that I shave my face every couple of days. I take testosterone, a low dose of testosterone, and I will show you that in a minute. But I have been, like, really stressed. I can't even, like, look up a video about how to shave your face because it makes me stressed and freaked out. And so I have tried a number of things. This is what I'm currently doing. This is from Target. It's, like, just a standard, like, it says Moroccan mint and cedar, which I love Moroccan mint things. Goodfellow and Co. I put, like, a little bit of this on. Okay. And then the, like, hair removal process is very stressful to me because I had, like, when I was a teenager, I had to start shaving my underarms and my legs because my mom said it was unsanitary, which I never thought to, like, ask, like, why is it not unsanitary for my dad to not remove that hair? But I fought hard against it. I got to delay it for, like, a year, and then I had to, and it was very traumatic, and I hated it for all of the years that I did it. And I just came to, like, hate hair removal because it became equated with, like, having to do something that didn't feel right for my body. And so this brings that up for me, and I don't like it. And so you might ask them, why are you doing it? I also don't like how the hair feels on my face because it's a new and unusual and itchy sensation, like, sensory-wise. So I had a, like, a electric one that actually felt better than this to me. And then we moved, and I haven't unpacked all the boxes because we're going to move again. It's just, like, a temporary in-between place. Okay, I think that's, and so I just was like, I'm just going to unpack, like, the essentials because it's only for a couple of months, but I can't find the charger for that electric one, and so it ran out of charge, and so I'm, like, not willing to buy a new one because I know that I have the charger. So I'm, like, doing this as an in-between, which is kind of silly. Maybe I should just buy a new one, or maybe I should just try and unpack the boxes and find the charger, but that's where we are, people. Okay. So then rinse that. And I don't have, like, I have mixed feelings about the facial hair. Mostly I don't like the sensation, and my kid doesn't really like the sensation. You know, if I'm, like, cuddling with him or kissing him, and that affects me because then I want him to feel like, I don't know, that's always been a thing about, like, is my gender stuff gonna make him feel, like, less close to me, which I don't want. I'm just rinsing off my face. So a lot of mixed feelings. And also, like, it's not quite like a beard. It's like, I mean, it's a lot of hair, but it's not like a beard level of hair. So I don't know. I don't know I don't know what I feel about it. I think it's just going to be, like, a process. And it's been a couple of years that I've been on testosterone, so I think, like, it kind of increases over time. So we'll see how I feel about it over time. Like, right now I'm happy not having it. And right now, like, most people perceive me as a woman, like, out in public. And I just feel like having a full beard kind of, like, creates more conversations than maybe I want to have right now in my life about my gender. So that's where I'm at. Okay, I just dried my face. Sorry, that was the tapping off of the razor thing. Okay, so there's that. Now, a lot of people who are on testosterone have acne. And I had acne as a teenager, and I had acne like initially when I started taking testosterone, but I started using tea tree oil every day. So I put tea tree oil on, and I do have more like acne on my shoulders and back and chest than I ever did. And then I also use this. I used to use body lotion on my face, but my face is a lot greasier now from the testosterone. So this is Cetaphil Gentle Clear Mattifying Acne Moisturizer Salicylic Acid Acne Treatment. Again, like, I'm not doing it because I have a problem with acne, how it looks. I just, it was painful, like painful that I didn't want. So this seems to have, like, I still have, you know, breakouts, but not as often, or not as painful. Okay, what next? Okay, the other thing that was really hard for me with testosterone is that you smell different, like really different, like a men's bathroom. Sorry. So I use this whole body deodorant by Lumi. I use the Smooth Solid. They also have like a cream, and they have like a one that's like more like a lotion in like a lotion container. I find that whatever is in this Smooth Solid does better for me. Specifically for my underarms, this is really good, but I don't smell that like smell that was bothering me. But for my privates, that was really bothering me, like really like disturbing me, that I was smelling like a really bad men's bathroom. And so I use that, and it is so great. And then also something that testosterone will do, and also perimenopause, menopause will do, is dry you out, like in your privates. So awkward to talk about, but I think it's important because that was the hardest thing for me. That was like combo perimenopause testosterone. It was like so uncomfortable. I was having like what seemed to be yeast infections, but they weren't yeast infections. And then like they were sometimes becoming, what's it called? BV, bacterial vaginosis. And there was just like constant itchiness and irritation. So I found this company, Honey Pot, which they also sell at Target, which is excellent. I take their vaginal probiotic, which I like swear by. I've tried every single other vaginal probiotic, and theirs is the bestest. And then they also have this anti-itch vulva cream, which I sometimes use if I need it, and that's very helpful. And then they also have, let me find it, this soothing lavender vulva cream, which is also nice. I also tried their lube, which I liked, but then I realized I was getting more irritation with that than without, so I do not use that anymore. Okay. What else? Okay, glasses, because my eyes are starting to hurt. So I used to use like this like eyeglass cleaner type things, but recently I changed to these lens wipes that are also from Target that are pre-moistened, and they're doing so much better for me. So I do that. Let me grab my glasses. And my glasses are not vision glasses, they're brain injury glasses. If I should make a video about brain injury stuff that I do, because I do so much stuff for my brain injury, and they're really, it makes my life so much more worth living. They have a medical filter, which is that slight like blue tint, and then they have prism lenses, which is does something magical for brain injury stuff. Okay, so then, and I use these eye drops, Similison eye drops, because my eyes are very sensitive. These ones are the allergy eye relief, but I find that like really any of them work great. Okay, what else? The testosterone. Okay, So testosterone topical gel, 10 milligrams is what I currently use. I use 3 pumps every day, and I put it on my upper thighs, like the inner upper thighs. And I was prescribed 5 pumps, and then I found that 3 pumps was really good, and also they were, you just like squirt it like this, it's clear gel. And I just go like this, and then I just rub it on my upper inner thighs. Just rub it until, kind of like hand sanitizer, until it like is no longer that wet feeling. So I got prescribed 5 pumps a day, and I actually started testosterone with the injection, but then I was experiencing 2 things. One was getting ready for like the shot day. I would have like extreme anxiety, and I would get so nervous, and I would like, I'm fine with needles and fine with shots, but giving it to myself was like so stressful. And so that was getting really stressful. And then also I was experiencing, this is just cocoa butter body lotion. Also it was stressful. As you can see, like everything in my life is from Target, apparently. These are my octopus tattoos. What was I saying? Oh yeah, I started with the injection. So it has like a dip, like I was taking it every 2 weeks, and in between, like towards the end of the 2 weeks, it's like, oh my gosh, I was desperate for it. And then at the beginning it was like, whoa, a little bit too much. So the gel doesn't have that because I get it every single day. And for those who want like way full like secondary sex characteristics, I think it can be hard to get full on gel. But for me, since I'm like doing it mostly for like psychological and someone just texted me, did we feel the earthquake? Wow, I didn't know there was an earthquake. Psychological and perimenopause reasons, because I don't bleed anymore, which is lovely, and I don't have my perimenopause symptoms, which let me show you what else I take for perimenopause. This is called Maca Femme, and it's herbal supplement with maca root in it and like a variety of other things, and helps reduce menopause symptoms, increases energy and vitality, promotes healthy sexual function, relieves PMS and PCOS symptoms, eases residual post-menopause symptoms. So it's like, I've tried a whole bunch of things again on this, and this, I took a break from it and I immediately had hot flashes again. So I really recommend this if you have perimenopause or menopause. I had been taking 2 a day for like ever. Now I've been taking more like 4 a day because I took a break from it and I got like really out of whack. But I think within like a month or so, I'm going to be able to go back to 2. So I switched to the gel, and the gel is like really happy for me. And then the gel like was out of like stock in my whole state, basically. I couldn't get it, and that freaked me out. And so, one second. So I was like, this is no bueno. Like, I'm so stressed to not have access to it because now it like really helps me so much. So I was like, prescribed 5 pumps. I was like, let me try 3 pumps, and then I can stock up a little bit. And so I have like a back stock of testosterone, which is great. Okay, so the other thing is that some people lose hair with testosterone or like have balding or whatever. I don't know if that's happening to me. I feel like it kind of is. Like, I feel like I can see more of my scalp than I used to be able to, but I don't know if it's just like psychological. And I want to be totally like, it's no worries about it, but I still have feelings about it. And so I'm just looking for something to show you. That's not it. One sec. So I did a little research. Oh, here it is. It fell down. And another friend of mine told me about this shampoo, which I'm going to show you. It's called Pure Biology, and I got it on Amazon. And it's like a growth stimulating, volumizing treatment for thinning, breakage, loss prevention, and growth stimulation for men and women. So also non-binary people. So I started using that some, which it's like very expensive. So I haven't continued because I'm like, I don't know, I might not be. So the other thing that I read is that these essential oils, peppermint oil and rosemary and peppermint, are good for hair growth, whatever, hair loss. So I just like rub that in, and I feel like that makes me feel like I'm doing something, and it's also kind of nice to give your head a good rub. The other thing that you will see people talk about with testosterone is that it makes you look older, or like it changes your skin. My pores are definitely bigger, and I definitely have like more wrinkles on my forehead, and I do think I look older, which is a-okay with me. Again, like the psychological benefits are like so profound that I really am happy to take any physical changes. But I feel like it does make me look older. Okay, there was one more thing I was going to show you. What was it? Oh, I was just going to talk a little bit about my scars. So some people do like scar treatments for their top surgery scars. These are tattooed nipples, so I don't have to do like any nipple care. Never had to do any nipple care, which was chosen by me because I felt like the biggest reason like people ended up having to go back and get revisions done was because like stuff went weird with their nipples. And like the biggest like hardship that I heard people talking about online about post-surgery was like that their nipples weren't healing and their nipples were like falling off and getting infected and stuff, and I was like, no thank you. So I just had them remove my nipples, and I got tattoos at the surgeon. Like the surgeon did the tattoos, and it was covered by insurance. And then like my scars here are a little, what's that word they use? They're like a little of the thing that people try to not get, which is like a little bit of bumpy, like thicker scars. Can you see that? But I'm okay with that. I love my scars and I'm not trying to hide them. These ones healed like really well. I think these ones got stretched out because I only had help for 4 days after my surgery. I paid a friend to stay with me for 4 days, and then I like went right back to parenting and like lifting and doing all the things that like I was supposed to take a break from for 6 weeks. So that's part of it. But like I'm really happy with how my scars have healed, and I didn't do any special, like I didn't do that scar tape. I didn't do like, I like massaged them a little bit, but not really. And I have full sensation all of here. There's only like mild numbness. I have full feeling, but there's like mild numbness here still, and like a little, sometimes I'll feel like if I'm sweaty or something, I'll need to like kind of rub this area. But they did tell me that the nerves regrow from the sides into the middle. So this is like the last place. And it's been like, I don't know, like 3 or 4 years now since I got my surgery. So it's really fully, you know, pretty much fully healed. This little middle part sometimes needs attention. So yeah, I don't do anything special for that anymore. I just put regular lotion on it. Okay, have a beautiful day. Thanks for getting ready with me. Obviously, I brushed my teeth too. Okay, love you.